special wax sort of softener, if you like, and that'll help me to clean those out as well. Okay, I'll run it on your tongue. So whatever you think you can taste, just let me know. Yeah, that's good jam. It is coffee. Well done. Hello. How are you? I see. And what is it that's brought you here today? Oh dear, that doesn't sound good. Well, you're in the right place. Absolutely. Have you been to us before? Well, allow me to introduce myself. I'm Dr. 𝗨𝗣𝗟𝗢𝗥𝗧, and here at the cranial nerve examination site we have invested an awful lot of our time and money into making sure that you, our patient, is very well looked after and thoroughly taken care of in all aspects. You're really rather fortunate today because we have recently completed our research. You're pleased to know that it's very intricate, it's very thorough, it's very conclusive, and we leave no stone unturned. If there's anything to be found, I will find it, and for your peace of mind I will give you your results right at the end of our session. So we're looking at around an hour of your time today, if that's okay. Fantastic. I do have a few details to take from you, and then I'm going to go through in lots of detail just exactly what you can expect today. Is that okay? Fantastic. So, as I've said, my name is Dr. 𝗨𝗪𝗧, so please can I take your information? And let's start with your title, please. And your first name. Do you have a middle name? And finally, your surname. Okay, and would you say that you identify as male, female, non-binary, or prefer not to disclose? And is your gender the same now as it was at birth? Okay. Have you been known by any other names before? Okay. And can I just ask for your date of birth, please, followed by your age, so I don't have to work that out? And your age is, of course it is, that's quite an easy one, I suppose. Now then, can you give me your defined origin, whether you identify as British, European, American, etc.? And your ethnicity, please. Okay, and what is the country that you were born in? Okay, can you please provide details of your next of kin, This is in case of any emergencies, or should we need to gain permission to turn off your life support. Okay. And contact number for them, please. Alright, that's about it done. And the best contact number for yourself. And an email address, please. Oh, okay, sorry, thank you. Alright. That all seems to be in order. So, can you just explain to me, in as much detail as you can possibly remember, what exactly has triggered your attendance today? I'll just make some notes as you're talking, so don't worry too much. Okay. And when was this? Okay. And on a scale of 1 to 10, at the time of the incident, where 1 is not very much, but 10 is quite severe, how would you say the pain or the impact felt? Okay. And thinking about today, what would you say that number would be? Okay. Have you sought any treatment already? Oh, just some paracetamol. But have you been to A&E, hospital? Okay. Alright. That's fine. So I'll put that down for a moment. Okay. I'm just going to pop on some gloves. Just to confirm, do you have any allergies? So I'm going to be performing a series of tests on you today. Some of them may feel quite invasive. Please let me know if you feel uncomfortable at all, or if you want to take a break. That's absolutely fine. It is quite an intense assessment today. So because of where the injury is, today I'll be paying particular attention here and here to your ears, just to ascertain whether there has been any hearing loss, any trauma to the inside of the ear, or anything else that we need to be aware of, because the sooner we can address that, the better chances are that we can fix everything 100%. Is that okay? So mainly I'm going to be performing a series of tests which will focus on the skull, the cranial, and that's really what we're trying to do, is identify if any of the nerves have been damaged which transmit from your various organs to your brain. Okay, so that's why we really tend to focus on your 5 senses, but as I said, we're going to be paying particular attention to your ears today. Okay, now I'll start off quite simply with some easy tests just to get you going, and then we'll move on to more intense ear tests as well. Okay, so first of all, I'm just going to start off by touching your skin. Just for your information, the skin is the biggest organ on the body, as of course it covers all of you, and should there be any trauma to it, it's usually very good at self-healing. However, I'm just testing the elasticity of it at the moment on your face. I'm just seeing how it responds to my touch. Okay, if you can just relax your face for me. Perfect. I'm just going to be putting a little bit of pressure on your cheekbones here. So. Okay, and across the eyebrows. And down the sides of your face. And underneath your chin. And just a little ear massage as well. Okay, that seems fine. Can you now perform for me a series of facial movements as I direct you? So, just still in the relaxed position. Can you please close your eyes and open them? Just closing them gently for now. Yeah. So gently close your eyes. Relax your lids and open. Great job. This time, can you close your eyes and really screw them up as tight as they can possibly go? And then open them wide. And just repeat for me. And open wide. Okay, super. Just how did it feel? Was there any aching, any skin resistance, any muscle twitching at all? Okay. Sometimes we can get the muscle twitching on the eyelid when you're tired or stressed, quite involuntary. Other times there's no reason at all for it to do it. If it does continue, if it's a regular daily thing, you may need to flag it up with your own GP. Okay, so this time I want you to purse your lips for me and release. Purse your lips again and release. Good job. This time I want you to smile for me as wide as you can, but without showing your teeth. And release. And again. Release. Good job. This time when you smile, I'd like to see your teeth please as wide as you possibly can. And release, well done. And again. I'm just going to touch your lips whilst you're doing that. Okay, sorry, release. Did I tickle? I'm sorry. Okay, really well done. This time, I want you to just close your whole face up as scrunched up as possible. So we're bringing in that pursed lips, but also the closed eyes, and just try to draw every aspect of your face forward if you can. Okay, this time, keep it hold. And I'm just going to try and push some of those muscles out of the way. Good job, you can release them. Okay, that's a great job, well done. Alright, so I have no concerns there with your facial muscles. Everything seems to be absolutely spot on there. Alright, so this time I'm going to just try a little massage on your face. I'm just checking that there's nothing underlying underneath the skin that should cause me any concerns, okay? So you can keep your face relaxed. You can close your eyes if you'd rather, but if you want to keep them open, then you may as well. Okay, here I go. sheet. Okay, this time I've just got a really, really soft bristle brush. Just want to feel this on your face. Nice and soft, right? Okay, this time I'm just going to touch the brush on your face, different parts of your face, and as soon as you feel it touch your skin, can you put your hand up to let me know you felt it? Okay, you ready? Fantastic. Sometimes the brush will just circle around, other times it will be touching. Okay. Just give that a little tick. Super. Okay, so for now I'm just going to leave the face and I'm going to move on to your eye examination. Okay, so we've got a few tests that I'm just going to run through. I will be approaching with light, so just to give you an advance warning, you didn't mention whether you had epilepsy or anything else that can be triggered by the use of light. Perfect, okay. So I'm just going to check that, and then we'll be doing a visual test, a reaction test, and seeing if you can identify certain numbers and objects as well. Okay, right, so I'm just going to start then with the light trigger test. So first of all, I've got two types of light. The first one is one that you may be more familiar with, which is quite an intense light, and it's very focused. This one is used to help me get right to the back of the optic nerve and be able to investigate everything that's going on behind there. And this other smaller, weaker light works in a similar way, but it's because it's quite weak. I tend to use this to focus on the front of the eye, looking at the pupil and the iris, and it just gives me a really good indication if there's any scratches or damages to the lens on the front as well. Does that sound okay? Alright, I'm going to start with the weaker the weaker light first of all, just because it's not as powerful, and sometimes if I start with a stronger light it can leave little spots in front of your eyes, so just be aware of that. It's nothing to be concerned about. It's absolutely fine. So this just sits on my finger like so. It means that I can use the rest of my hands to really get into that, and we've already tested tested your muscle strength and things, so I'm able to open up the eye and use my fingers to do that. So just keep really, really still. I'm just going to start here with your right eye first, okay? There's a little bit of resistance on your eyelid there, don't worry about that, just try to keep them open as best as you can. Okay. Yep, that's great. Okay. I'm going to do the same with your left eye now. Here we go. And again, you might feel a little bit of resistance as I'm pulling the eyelid open. Please don't try and stop me. That's really good, well done you. Are you okay with the light? Do you want to take a break? Okay, so this next one, as I already explained, is a more intense light, so if you're feeling comfortable for me to go right ahead, I'm just going to come and get quite a lot closer now, just because I do really need to see behind the eye. Is that okay? Yeah. If at any point you are feeling uncomfortable, and as I explained before, if you want to take a break, again, that is absolutely fine. I fully understand. Okay, are you good to go? Great job. Okay. So the light is on, and again, I'll start with your right eye. So. Okay. Okay, good job. I'm going to head over here to your left eye. Yeah. Don't look up right to me. Did notice a little bit of a tiny scratch on your retina, which might explain some of the irritation you were talking about before, with you saying the eyelid keeps twitching. Then again, if you're tired and you're finding yourself rubbing your eyes quite a lot, it could quite easily even be from that. I've got some drops which I'm going to put in anyway for you, and I'm just going to see how your eyes react to those. So these are just the standard Ultrix drops. Now I have just got the one which is just the basic standard one, which is just refreshing to help tired eyes. It helps lubricate the eyeball itself, and it'll remove any excess dirt if that's in there as well. Although I highly recommend, if you have been having those little spasms, as we call them, already, then there's this one which is for dry eyes as well, and that might help relieve and want you to sort of stop the rubbing idea as well. Yeah, okay. I'll tell you what I'll do then. So I'll try this in one eye and the more intense one in the eye that you said giving you the little spasms, and then I've just got some lenses for you to try as well. Okay, so if you can just relax for me as best as you can, tilt your head slightly back and your eyes wide open. And you said it was your left eye that was irritating? Mostly. Okay, I'm going to put the more intense drops in that one for you. So, eyes wide open for me. Great job. And if you can give a blink. Perfect. And now for the other eye. And wide open again. Tilt your head slightly back. There we go. And give a little bit of a blink. Okay. So the final thing I want to check then is just with the set of the lenses on, if these make any difference rather to your eye in perception. I've just got them slightly damp with the optics, but at least it's a trick, isn't it? So you just pop these on for me, just there. That's great. How's that? Okay, yeah. Okay, can you keep those on for me? I just want to try something. Alright, so freshly sealed pack of playing cards here. Not always easiest the thing to get off with these gloves on, but we'll give it a go anyway. There we go. On the side. Okay. So there's only the two basic colours in the playing pack, one being black, one being red if we don't count the jokers, of course. Put back in there. And if you can just identify whether I'm showing you black or red. Good job. Good job. Good job. Okay. And this time, can you tell me, I've just realised it wouldn't be a new deck, they're absolutely not very well shufflable. Give them a quick shuffle, makes it easier. It's a bit more random, isn't it? This time, can you identify the number that's on the card? If it's not a number, if it's a jack, queen, king, for example, identify that as well for me. It keeps popping up today. And this time, if you can identify the suit that I'm showing you as well. Not as well, just identify the suit. Great job. Okay. Pause the back in their box. Let's take those glasses off you. How did you find the glasses once we put the drops on? Yeah, that's great. Okay, so I'm just going to make a quick note of that. Fantastic. Alright, so I've now finished with my test. And what I'm going to move on next is with your taste test. So I've got a series of tests for you. You're going to see if you can identify the taste, and then you're going to be able to tell me whether some things taste salty, sweet or bitter. So 3 different possibilities. So each of the items are on an individual coffin swab, which I've got all here in a box. So there are quite a few to go through. We won't do them all today, but we will do quite a few. So let's just start. Just to confirm, there are no nasty surprises. Everything is something that you might want to taste in ordinary life, so nothing to worry about there. Alright, so I'm just going to ask you to just stick your tongue out, and I'm just going to put the first drop onto your tongue with this one. Okay, and I'm going to on your tongue. So whatever you think you can taste, just let me know. Yeah, that's good jam. It is coffee. Well done. Okay, next one. Yeah, peppermint. Good jam. Ready? Yeah, it is berry. Can you be more specific about the berry, or it's just no berry? Okay, that's fine. Next. Yeah, toffee flavour, good job. And what about this one? Melon, well done. We've got 3 more of these left to go. Are you ready? Orange. Quick look. It's nearly lunchtime. Very hungry. And this one. Pineapple. And the final one. Chocolate. Good job. Well done, you. Okay, super duper. Pop those down. Okay, so I've now got a series of clear bottles, so it doesn't give them away. And I'm just going to put a few drops on your tongue. And I would like you to just to tell me whether you think it is sweet, salty or bitter. It doesn't necessarily have a flavour. I just want you to ascertain sweet, salty or bitter. Are you ready? Great job. Just put your tongue it for me? Okay. Next one. Okay. Yeah. Let's try this one. You can catch you dribbling. Yeah, good job. Okay, great. Let's do more of this one. Let's go for... let's see. Okay. Great work. Okay. And finally... yes. This one can sometimes confuse people, so let's see what we make of this one. Yeah, you can put some more drops on. Good job, well done. Okay. Let's pop those down. Alright, so far I've checked your skin, we've checked your taste, and I've checked your eyes, sorry. So I still need to check your sense of smell and your hearing and also your touch. Okay, so have you got a preference of which one we do next? Okay, well the sense of smell one isn't very long, it's literally just what you can smell. Good job, okay. Alright, so we've got a series of spritzes, and quite simply I just spritz this in front of you and see what you can ascertain you think the smell is. Okay, great work. So, let me just see which bottle number this one is. Alright, so first one, a little bit sticky. When we get these in, we have to take the labels off so you're not able to tell what scent is what, and then I just number them up. Yeah. Okay, you ready? Okay. Coconut, great work. Okay, the next one is number 3. Okay, ready? Yeah, you're right, it's rose water, well done. Okay, and bottle 17. Ready? Yeah, it is. That's lemon, well done. Okay, let's go for you. Let's bottle 35. Lavender, thank you. Let's just try one more. I think, yeah, okay, let's do this one. Fun one. Garlic, great job. You got that down, haven't you? Easy peasy. Okay. So, 2 tests left, really. Want to test your touch. So basically that involves a blindfold, blindfold, and have your hands out, and I will be putting different sensations on your hand. So I want you to choose the best word that you think describes what I'm touching you with. So for example, if I touched you with a pin, you might say that feels sharp. Something might feel blunt, rough, smooth, bumpy, whatever you can feel. Does that sound okay? Brilliant. Okay, let me just get the blindfold for you. Alright, so I'm just going to pop this blindfold on for you, and it's quite a nice pack. It's got a cute little kitten on, and these has got some really nice little gel beads in, which are quite cooling and soothing for the eyes. So I'm just going to pop this on here for you. Just let me know if you're uncomfortable at all. There we go. Alright. Comfy? Fantastic. Okay, palms up and out, please. And would you say the first object is smooth or rough? Have a good feel. Okay, that's absolutely great. And what about this next object? Would you say this is smooth or rough? Okay. So thinking about this next object, would you say that it is soft or hard? Okay, good job. And what about this next object? Okay. And our last two, the words I'm looking for are either wet or dry. Okay, and what about this next one? Fantastic. Just going to take that blindfold off you. Okay. Fantastic. Now the final test that I want to do today is the hearing test. And I said earlier that we would focus quite a bit on this. There's a few things I do need to test you on, just because this is where you indicated the trauma was, and obviously it deserves a little bit more attention. So I just want to use these to listen to the blood pulsing through your ears. Do you ever find you have that rushing sensation in your head and you can feel your own heartbeat through your ears? That's what I'm just going to be listening for, so you can just sit comfortably. That's working really well. Okay, so just listening to the first ear. Great. To the side. Super, that's fine. Okay. Sounds alright. Still managed to hear lots of blood rushing through there. Okay. I just want to take a really good look into the ear, and I just want to investigate the ear canal. So you can see the image just behind me on the wall here, just to clarify what I'm going to be investigating. So you can see where it's pointed out at section 1 on the ear. This is the outer ear, so that I can't see any trauma on that at the moment. So I'm going to be putting the light just through here, okay, through the inner ear, and this will allow me to see all the way down here. This is the ear canal, and I'm going to be able to study the eardrum, which is indicated here, by the number 5, and I'll also be having a look at the estrogen tube, which is just a little bit further behind it. Okay, in here, and then it'll also allow me to see the inner ear and the anvil bone and the stirrup bone, as well as the hammer bone. So all these bones are all gathered around here. And then we can see if there's any trauma to the cochlea. So the cochlea is really important, this spiral shape here. Okay. Finally, I'm going to be checking the auditory nerves. So these are the nerves that send the information to the brain. Okay. Just put this back up here for you. Okay, let's start with the right ear first of all. Okay, that looks. So I'm just trying quite. Alright, that seems okay. So I'm just going to come back and have a look over here on the left ear. Okay, that's quite clear. So what I want to do is I'm just going to pop on some headphones here. So, is that right? Okay, so just popping those on for you. Alright, so I'm just going to say some words, and it does sound a little muffled, yes. I'm going to say some words, and if you can just repeat what you think you can hear, and we'll just be able to detect whether one side or the other is any more muffled. So let's put those back. Alright, so your first word, pickle. Great. And trauma. Template. Whisper. Turnip. Pepper. Triangle. Drift. Sneaker. Capture. Makeup. Lip gloss. Lick. Stipple. Tankard. That's fantastic. Okay. This time I have a different set of earplugs. So these are fresh, these are brand new, these are yours. And I'm going to put those into your ears on both sides. These should really block out any sound. Okay, and what I'm going to do is I'm going to give you a series of buzzers. As soon as you think you can hear them, you can raise your hand. Okay, you ready? Is that okay? Okay, great. Listen. Fantastic. Let's put those back. You can keep these if you like. They are, of course, yours to keep. We don't reuse these. There we go. In our little case. You can be for a while though. Okay, so one last thing I just want to check is that I'm going to give your ears a little bit of ear clean, a little bit of wax removal, just because when I was looking in there was quite a bit of wax build up. So first things first is I'm going to put some drops into your ears. And, this is a special wax sort of softener if you like, and that'll help me to clean those out. So let's go. I'm just going to pop it in your ears, give it a few seconds, and it should do its job. Put it in there. Okay, and if you just tip your head to one side, make sure the drop's going in. Just press those in. Great. And let's try your other side. Similar, just tip and press those in. Just going to give that a bit of a moment, and then I'm going to get really quite deep in that and clean out all that excess, if you will. And please don't be embarrassed, I see these things all the time. Just going to put a bit of softener onto this as well, which is going to help a little bit with the manoeuvring of the pud into the ears. So and this one, the other one as well. Okay, so I'm just going to get nice and deep, so could tickle just a little bit. Let's start with your right ear. Here we go. Wow, that's a lot of wax. I might actually need a second to cotton bud. So okay, so I'm just going to grab a couple more of those cotton buds. I'll pop two of it in, but there we go. And let's try your left ear. If there's any cleaner. Okay, slightly not quite as bad, but still fine. There's a lot of product going on in here. Okay, I'm going to use a second cotton bud for this. So we've got most of it now. That's something that's really done the job, right? Alright, so let's just discard those. Nobody needs to see those, and thank goodness for gloves, eh? Alright, so how are you feeling now? Okay. Oh, that's really good to hear. I'm pleased. So, as I said before, it was a really thorough examination, and your results have come back really, really good. I'm really impressed, and I'll be honest, I don't think you've got very much to worry about at all. Now, that being said, I will sign you off on your sheet now, but if you do have any other worries, you absolutely must come back to see us straight away, because you've already been in for the assessment. If there's any follow-up issues, you automatically get jumped up with you. As such, yeah, I can see you straight away, so. There we go. Alright, so, yeah, do you want to take some of those eye drops with you that we used before? Yeah, let me just grab those. So, as I said, we've got either the standard one, or I've got more intense. Yep, you can take them, that's absolutely fine. You can go with your earplugs. Go ahead. You're very welcome. Is there anything else I can do for you today? Oh good. Yeah, you're very welcome. And hopefully I won't see you too soon, but if I do, then yeah, so we do. It's been great to see you again. Thanks very much. You have a great day.